Hi, everybody. Welcome week 4. We're going to do hospice, home and parish nursing this week. We're going to take a look at parish nursing and how that involves in the community nursing as well as home and hospice. As I know, a lot of us have worked in home health care, so we're going to be sharing in class some of those experiences. But for now, let's take a quick look at a video on parish nursing, and then we'll take a look at our PowerPoints for this week.
Sharon Clohesi's world was turned upside down by one phone call when she discovered she had both a hole in her heart and breast cancer. Unemployed and uninsured, James Dobson's high blood pressure was life-threatening. Shortly after Karen Houston's husband suffered a nearly fatal brain aneurysm, her daughter was diagnosed with diabetes. Unable to sustain her oxygen levels, Lily Giacchetti spent more than 1 month in the hospital. Though these people were dealing with devastating illnesses, they did share one advantage. They each turned to their parish nurse for support. Across the country, parish nurses practicing the specialty of faith community nursing are improving public health by reclaiming the historic roots of health and healing.
This is your bubbler. How often do you change the water?
I have to change it every day.
When Mrs. Lily Giacchetti was hospitalized for nearly a month, parish nurse Ramona Davis made daily visits.
My illness was really serious, and everybody knew it.
I visited with her. I followed up and explained a lot of tests that she was required to get that she really didn't understand. When she was ready to be discharged, I made sure she had her equipment, she had visiting nursing, she had her oxygen set up. 128/70, that is really good. You are doing such a wonderful job.
Yeah, that's right. There are a lot of churches in our neighborhood, but there's only one parish nurse. And people will come in, they'll leave other churches and stop by to see Ramona.
I wonder how in the world I could have done ministry without a parish nurse.
So I'm going to give everybody a handout.
Ramona's duties range from assisting the critically ill to supporting church activities and promoting wellness.
I do a lot of health teaching with the kids from the school and the confirmation kids at the church. So we're going to look at it from a religious standpoint. We currently have a gospel aerobics class, which is intergenerational. We get to interact with people on an everyday basis. If there's a change, you notice it.
How was your blood pressure the other day? Okay.
It was 135 over to 85.
Oh, goodness.
We have these long relationships with people.
Okay, take a deep breath.
I've known some of the people that I care for now a good part of my life because this church is where I was raised.
These long relationships enable parish nurses to treat the body, mind, and spirit. When Karen Houston discovered her husband had a brain aneurysm and her daughter was a diabetic, she questioned her faith and her ability to cope.
I thought I was going to pass out. You know, like I had to have some place to sit down. I probably would have had a nervous breakdown without Michelle.
Nurses do have one step in the sciences and one step in the humanities. And I think parish nurses also have that other step in the spiritual through this holy anointing.
Okay, we're going to stop right there. So just an introduction for what parish nursing is. A lot of people didn't know about it. One thing I do want to mention about parish nursing is that the parish nurse does not need to be part of the congregation that she's working with. There's two different types, and we'll take a look at that. But what I want you to know is that something to be aware of as nurses is that we need to really be aware of our beliefs as well as the beliefs of those around us that we're treating. So when we take a look at that, I want you guys to remember that and to think about that when we take a look at that. So what we're going to do now is we'll take a look at our PowerPoints for the week, and we'll go over those for our chapters. They will be posted for you guys as well, so you can review them with your reading. And if you have any questions, we'll certainly go over those in class. So we're going to take a look first at our PowerPoint for chapter 4. So I'm going to share my screen with you guys and get on our chapter 4. Okay, so we're going to take a look at government and law and policy, which we should have covered last week. And I just wanted to make sure if there were any questions on our last week's government and how it will work with our Healthy People 2030. We took a look at our organization and agencies and our federal health agencies and those that influence health and so on. So impact of government health with structures of nursing. We remember that we have certain laws, constitutional, legislative, and judicial. And so these are different laws that are going to be specific to our practice. So we have our scope of practice with our Nurse Practice Act, and we know that that involves defining nursing, setting credentials, and distinguishing between the practices of nurses. So I'm going to stop sharing there for just a moment. And so it's just a review of what we went over for last week. And for this week, we're going to be taking a look, like I said, at our parish and hospice nursing. And so let me just get our PowerPoints for that, which I apologize, but those were not opening. And we will take a look at different phases of nursing that we look at. So here we're going to take a quick look at our faith community nursing, and that's going to be our parish nursing. So when we take a look at this, what we want to make sure that we think about, like I said, is our biases and knowing. We have our objectives and we have our introduction. So no faith community nurses work in close relationships. They're a big part of the community. They're going to balance knowledge and skill in the role and facilitate community. It's gaining prominence as nurses are reclaiming their traditions of the multifaceted health and well-being along with faith and what they believe in. So we have different things. We have a congregation, which is a group of people that are going to work together, as well as a parish. We have different spiritual care, religious care, and whole or whole person care. So things we remember about that. So know that in our faith-based nursing, it's a recognized nursing practice. Sometimes we'll see a confusion between religiosity and spirituality. So sometimes there'll be more of a basis with a higher being, and sometimes it'll be more about seeing the world with a spiritual twist. So know that we are going to engage with close relationships, balance our knowledge and skills, and address health concerns of everyone. We look at it, and it was in the roots in the Judeo-Christian tradition. In 1984, we saw the concept of parish nursing introduced in Chicago, and it was really holistic health centers, which are focusing on the whole person, okay? Their spirituality, their religiosity, and their health as a whole. We have parish nurse coordinators and neighborhood nurses. We know that we form relationships with partnerships. Know that we have our healthcare system, which is challenged, and so nurses are positioned to provide low-cost and holistic community care with vulnerable and underserved, as well as collaborate with others. We create community partnerships. When we look at the profile of the nurse in the faith community, we know we're practiced by the Nurse Practice Act, and we know this is our scope and standards of practice. Variation in the depth and breadth of what nursing practice results from our education, our experience, our practice setting, and our goals. Spiritual dimension is central to the practice of parish nursing. Know that we look at both knowledge and skills in nursing, the humanities, and theology when we're focusing on parish nursing, and services that the nurse emphasizes are strengths of individuals, families, and communities. Nurse interventions and programs that are used in the faith community will see personal health counseling, health education, emotional needs with grieving, pastoral care, and services to our vulnerable population. For education for a parish nurse, you're going to look for a bachelor's degree and basic understanding of the concept of parish nursing, really. So that's really what we look for. And an evidence of a mature faith, because if we're going to go into a community and we are not aware of our own faith and our own spirituality, it's going to be difficult to address that with others. And then we have our models of care. We have institutional and we have congregational. So institutional is going to be where the nurse is involving the community as a whole. And with congregational, they're going to be focusing on one congregation. And sometimes they're paid, sometimes they're not. Issues that we see with community health nursing, we see professional issues, documentation issues, because remember, they're going into homes, they're going into churches, so they may not have a documenting system, legal issues, financial issues, and future growth. With Healthy People 2030, we look at our objectives and we're encouraging communities to help with support and offer an ideal setting for health promotion and long-time positions of esteem and influence in communities. So that about covers our parish nursing. What we're going to do from here is we're going to go on to home and health hospice care, which sort of overlaps a bit as well. So let's take a look at our chapter 30, which is going to be our home and hospice care. And so we'll take a look at this as our slideshow. So we look at our introduction in public health, home health, hospice, and palliative care are expanding. We know that there's a lot more at-home care that's going on, and that is because of finances. So we know when nurses practice in these specialties, we're going to provide comprehensive assessment, planning, and intervention. 2 additional nurse-led models are going to be summarized: the nurse-family partnership and traditional care. We look at public health and home health services, hospice services, palliative care, interprofessional collaboration, and population health. So we know when we're working with families, we talked on this in another chapter, but our family is defined by the individual and includes any caregiver who assists in the care. Remember, family is not defined as just those that live in the household. It may be people that come to visit, things like that. So make sure that we're looking at basic needs, providing direct care, and meal preparation and treatments. When we look at home health, we see in the 19th century, charitable organizations went to care in the homes by hired nurses. We had the Henry Street Settlement House in the 1900s. Metropolitan Life Insurance Company included home care as a benefit. And when you think about that, that's an insurance company that's working to cut costs. And that was in the early 1900s. And then in 1965, we saw home care as a benefit for Medicare enrolled, so our older population, and nurses who work in people's homes were really working to help them be successful in their home environment. So we know it's focused on primary, secondary, and tertiary prevention, like is most of community nursing. Our primary focus is going to be involving aggregates similar to those as other population focus. So specialty area practice that promotes optimal health, well-being for patients, their families, and caregivers. We're going to use a holistic approach, and we're going to provide nursing services to patients of all ages and cultures. Some home health agencies will include wellness programs, health fairs, school nurses, communicable disease prevention, and other programs. Medicare, we know, will provide for skilled nursing and skilled nursing services only. So they're not going to provide and reimburse for those activities of daily living. When we look at our evolution of hospice and palliative care, in 1969, there was a paper written on death and dying. And then by 80 and 81, we saw Medicaid and Medicare reimburse. In 87, we started to see palliative care. And then 99 and 2010, we have criteria for palliative care at hospital admissions and during hospital stays. Hospice and palliative care are similar and yet different. They're engaged on the client. They're holistic, based on evidence-based practice. We emphasize on ethics, communication skills, care coordination, transitions of care, caregiving skills that include our symptom management, pain relief, and comfort. Differences are going to be related to reimbursement requirements in our country and the length of stay and frequency. Palliative care is a broad term that occurs over a longer period of time, and hospice, as we know, is a short-term period at the end of life. So palliative care means that the patient and family-centered care is going to optimize the quality of life. Palliative care through the continuum involves the physical, intellectual, emotional, social, spiritual, and autonomy. We're going to make sure hospice focuses on comfort for individuals and their families. Palliative care has no specific federal designation as a specialty, and we see hospice as a formally funded program with a lot of data. So we have nurse-led models. We have the Nurse Family Partnership, and it's best known and well-funded nurse home visit specialty program. It's a network of nurses, families, and policymakers. We look with this to improve pregnancy outcome, child health and development, economic sufficiency of the families. And then we have transitional care, which is going to be our set of actions that are going to ensure that we have coordination on our healthcare as clients transfer between different locations. We have low and high interventions, and our outcomes really are most common to reduction in hospital readmissions in our transitional care. Our standards with our scope of practice, we have it with our nursing process and our standards. We have the Omaha system, which we want to know is our only American Nurses Association recognized terminology for practicing nurses in the community. Goals of the Omaha system include developing a structured and comprehensive system and foster collaborative practice once again. So we guide practice and patient decisions, sort and document client, and provide a framework for our practitioners and administrators with our Omaha system. So guidelines for nurses in home health and hospice care. We're going to have positive attitude about client-centered care. We're going to have critical thinking skills, effective care coordination, knowledge and skills involving medication, treatments, documentation, and equipment. No, our clinical example is from our community-focused practice like we spoke of in week 1. We take a look at accountability and quality management. Do know that it's difficult sometimes to monitor in a home healthcare environment our quality management. We, of course, base it on evidence-based quality and performance improvements. We look at our outcome-based quality improvement. We look at benchmarks that are met, client outcomes, and our accreditation. We want to make sure that with home health and hospice, we're doing our certifications and our roles. We're making sure that we look at box 30.4 factors for successful interpersonal collaboration. Legal and ethical and financial, we need to be familiar with living wills, power of attorney, and do not resuscitate, and the differences there. We take a look at our HIPAA, make sure that's not being violated, or ethical care, and making sure that we're careful with our reimbursement mechanisms and avoiding insurance fraud and kickbacks with our home and health hospice care. We have our Healthy People 2030. We have some objectives there that we look at. Know that technology, informatics, and telehealth has really helped in this area to make people access care a little more friendly. So that covers our 2 chapters on home and health and hospice care. What I will tell you as well is that we touched on chapter 4 last week, and we will cover a little bit more of the legal and financial during class this week. I will send you guys the PowerPoint so you will have access to them. Please do your reading, keep up on your all of your assignments, and if you have any questions, you guys know how to contact me. Take care, and I'll see you this week in class.